event is hosted by the Vermont Conservation Voters, our C3 partners, the Vermont Natural Resources Council, Hunger Free Vermont, Planned Parenthood of Northern New England, and VPIRG. I also want to note, this is such a hot topic that we've also got a number of elected officials in the room. And so I want to thank Representatives Che Waters-Evans, Leonora Dodge, Tiff Bloomley, Braham Klempner, and former Representative Mike Young-Toshka for all being here this evening as well. They're here to learn and also will soon be fonts of knowledge for all of you as well as your elected representatives. Just over a month ago, the U.S. Congress and the President jammed through one of the most destructive bills in the modern era. We all watched as senators and representatives chose the politics of their president over the needs of their constituents. It was stressful and it was sad, and all of us, I think, are still a little shell-shocked. This evening, we're going to try to ground what's happening by hearing from some Vermont experts about how this bill will affect Vermonters in the areas of energy, healthcare, and food security. We will also discuss how Vermont's government can protect and support Vermonters in the wake of these massive cuts, and what you all can do in this moment to take action. During tonight's panel, I'm going to start with some overview questions for the panel. Then we're going to turn over, a lot of you gave questions when you registered for the event, so we're going to do some of those registration questions from folks. And then if you should have seen the cards that were on the registration table, if you think of a question while you're here tonight, you can write on that cue card, and when you're done with it, raise it up, and one of the Jack or Evelyn or Hannah will come around and grab it from you and bring it to me, and we'll ask some questions directly from you this evening. All right, well, let's get started with the panel this evening. We are really fortunate to have a great lineup of experts, including, starting on my left, Ben Edgerly-Walsh, Climate and Energy Program Director at VPIRG, Ivy Enoch, Director of Policy and Advocacy at Hunger Free Vermont, and congratulations, that's a new promotion title, congrats. And Jessica Barquist, Vice President of Public Affairs for Vermont at Planned Parenthood of Northern New England. These folks are gonna really set it up for us now in this first question, but I will also note that there's gonna be some slides behind the presenters during their sections of the first part, just to give you some facts about their areas of interest. If you are having a hard time reading them, right back here, the fact sheets that are on the table have a lot of the same information, so there are fact sheets available if you want to have something a little closer to you, and there's a fact sheet for each of these areas. With that, we'll go ahead and get started with Ben. Ben, can you tell us a little bit about yourself and your background in the energy field, and in doing so, can you frame up the work you do and what recent federal cuts mean for your work?
Absolutely, and thank you so much, Dan, and the whole VPIRG, VNRC, VCB team for hosting this and giving us an opportunity to speak to you all. So again, Ben Edgerly-Walsh, I run the climate program at VPIRG. I'll keep the bio light since we're covering a lot of ground here, but I've been doing this work of running VPIRG's climate and energy program for a little bit north of 15 years. I've seen a lot of things in that 15 years, and nothing really comes close to matching what we saw coming out of DC last month, and that's of course to say nothing of the many other horrible things that the Trump administration's been up to. In short, my work at VPIRG is to try to help Vermont get on a path to cut our carbon pollution and really lean into the transition to cleaner, more affordable energy in this state, and make sure that that's a transition that every Vermonter, every Vermont household, every Vermont family and business can be part of, because if you don't do that work, otherwise it's a transition that is much more available to upper income Vermonters and much harder for lower income Vermonters to access. And frankly, a lot of what we saw out of DC, really is going to make that work much harder. So I'm not going to try to do a comprehensive overview of everything that was in the big ugly bill that they passed that is bad for Vermont and bad for the climate. But let me just touch on some of the lowlights, and then I want to touch on a couple of things that they're doing outside of the legislative process, because it turns out that's pretty horrible too. So in that bill, it ends the tax credit for new and used EVs. There's a tax credit that just barely got up and running for used EVs for low and moderate income Vermonters that's going away. That's September 30th. End of this year, tax credits for efficient appliances, for electrification, for solar on roofs go away for homeowners. Solar and wind tax credits go away shortly thereafter. And a lot of these things are things that have been in federal law for decades and have been renewed over and over again on a bipartisan basis. It was only very recently that the idea of helping Americans access cleaner, more affordable energy became partisan, and it's really sad to see that. The other things that we've been seeing out of the Trump administration, outside of this particular bill, that are really impacting Vermont, are their attempts to claw back money that was legally allocated to the state under various Biden-era activities, laws, grant programs. For instance, the state was granted about $20 million to build EV charging infrastructure to make that transition faster and easier. And the Trump administration tried to claw that back. Our Attorney General, Charity Clark, was part of a multi-state lawsuit to unlock that funding. Unfortunately, our governor and his administration here, Governor Scott, chose not to support the state's lawsuit, and as a result, almost every state that was part of that lawsuit had that funding unlocked, and Vermont did not. We do not have access to those funds in a way that many other states do now, because the Scott administration chose to back down from that confrontation with the Trump administration. And we're looking at potentially something similar happening in the solar arena. There's about $60 million the state has gotten under the Inflation Reduction Act for the Solar for All program, which Bernie came up with, and his staff wrote that part of that bill. And this is $60 million that's supposed to build solar in our state, create jobs in our state for low and moderate income Vermonters to cut their energy bills and have access to clean electricity for the first time. And it just broke literally yesterday that the Trump EPA is looking to eliminate that program, claw that money back from Vermont and all the other states that are rolling out these programs. We don't know whether the Scott administration is going to oppose that action by Trump. So I'll talk more about this later, but making sure that our elected officials are standing up for Vermonters is definitely something we can do. The last thing I'll say is, in climate and energy is a little bit different than the other areas you're about to hear about. The effect of this is cumulative. Yes, it is going to make it harder for low and moderate income Vermonters, especially to get into an EV, to get a heat pump, to cut their energy bills. But really the effect we're looking at is the climate crisis is going to be far worse than it needs to be because of this bill and all the other actions we're talking about. Electricity rates in this country are going to go up because we're being really dumb as a country and saying we should make it harder to build certain types of electricity that are cleaner and more affordable. And we'll get to, what does this mean in Vermont and what can we do in Vermont? But some of the other areas that we're going to be talking about tonight are much more acute. Are not, can you get an EV and save money over time, but can you feed your family? And I want to be very clear that we need to keep on taking action on climate, but we also need to be very smart about prioritizing our work in the short term to reduce harm for Vermonters.
Thank you, Ben. Ivy, can you please do the same thing for hunger free and food security?
Yeah, absolutely. Hi, everybody. It's really nice to be here with you all. I'm Ivy. I'm the Director of Policy and Advocacy at Hunger Free Vermont. Hunger Free Vermont is a statewide anti-hunger organization that's working to end the injustice of hunger for everyone in our state. I have been with Hunger Free Vermont for a little over 5 years, most of those years leading our SNAP policy and advocacy, but as Dan said, I got a promotion. So my deepest area of expertise is in SNAP policy, which I'll be speaking to this evening. But I just want to start by saying that this work is also very personal for me, and I know it might be for many other folks in this room as well, who, like me, were maybe raised on SNAP and free school meals, or who are maybe tapping into SNAP and other basic needs programs now, or have at other points in life, because many of us have. So we're in this room talking about federal policies and what it means for Vermont, I know we all know what I'm about to say, but what we're really talking about are people, right? Like our friends, our family, ourselves, and what it means for our communities. So this is really personal business for all of us. As I said, Hunger Free Vermont is a statewide advocacy and education organization that's really focused on policy solutions to ending hunger, as well as public education about the root causes of hunger and technical federal nutrition program training for service providers who do incredible work on the ground in making sure that these programs are available for Vermonters. Our advocacy focuses on ensuring those existing federal nutrition programs truly work well and are easily accessible for Vermonters, while also working on policy solutions that ensure food security for all in Vermont. And our training and education assistance for service providers, again, those folks who are on the ground every day in communities, navigating complex applications, benefit maintenance. We provide technical support to those folks so they have the information they need to help folks navigate these programs with care and with ease. And the partners that we have in that work also directly inform our state and federal advocacy work, so it's a very crucial feedback loop. What this bill means for our work is a question that we have really been grappling with long before this bill passed, right? We've been thinking about this since February. And this harmful mega bill is a direct attack on basic needs programs. That's not dramatic. There's really no other way to say it. And so it not only has a profound impact on the work that we do every day at Hunger Free Vermont, but the people and communities we stand to serve. So this bill made historic, in the worst way, damaging funding cuts and eligibility changes to programs that support people in buying groceries and putting food on the table and accessing medical care, really basic needs programs. I know we'll get into the details of the specifics of the bill, but what these historical cuts and eligibility changes to Vermont mean in the short term and over the next few years are higher administrative costs for our state to actually operate the SNAP program, which is known in Vermont as 3 Squares Vermont. More red tape for folks who are trying to navigate eligibility and applications to get the benefits that they are entitled to and need. And then eligibility barriers and in some cases full-on bans to accessing SNAP for certain population groups, including folks in our immigrant communities. So this terrible legislation really pulls basic needs resources away from everyday people, and it will make it harder for us everyday people to meet our basic needs. And not only will it be harder for the 65,000 people in our state who currently participate in SNAP, that's 10% of our population, to put food on the table, but it will have ripple effects that impact our grocery stores, our farmers, and our state economy as a whole. Because not only is SNAP the most effective anti-hunger program in the country and in our state, it's an extremely effective economic stimulus program. Those federal dollars that folks get on their SNAP card every month to buy groceries amount to a little over $12 million every month. And that federal money is being used at our local grocery stores, at our farmers markets. So it's a very important economic stimulus program for our state. What's important to note, I think, is that we will all be impacted by this federal legislation in one way or another. And some ways we can predict, and in other ways we can't. And we really, I think Dan said, we're shocked, we're still shocked. We're still working to understand the full scope. And so again, I know we'll get into the details here soon, so I'll leave it there. But I just, again, really appreciate being on the stage with everybody and for all of you for being here.
Thank you, Ivy. Jessica, Planned Parenthood and Healthcare.
Yeah, thank you. Hi, everyone. I'm Jessica Barquist. I work for Planned Parenthood of Northern New England, and I'm really proud to represent the work that Planned Parenthood does in the state. So Planned Parenthood of Northern New England is more than just what you know us as. We provide comprehensive reproductive and sexual health care to more than 16,000 people in Vermont at our 6 health centers and virtually through telehealth. And so people come to us every single day for affordable, high quality care, which includes wellness exams, birth control, infection testing and treatment, cancer screenings, abortion care, as well as limited primary care. So our business model is one of service, and we see everyone who comes through our doors, regardless of their ability to pay. Over half of our patients have low incomes, which is defined as twice the federal poverty level. And last fiscal year, we provided over $1 million in free and discounted care to our communities in Vermont. So in Vermont specifically, PPN&E sees about 16,000 patients a year, and approximately 1 in 4 of them have Medicaid insurance. And so our health centers are really supporting our most vulnerable patients in Vermont, and we're often the only healthcare provider that a patient will see in a single year. So this budget bill that we're talking about had an immediate defund of Planned Parenthood in the bill. So that means that as of July 3rd, we were no longer able to bill Medicaid for our services. So we will continue to see those Medicaid patients, but are unable to submit for reimbursement for those services. And these cuts are not just about abortion, right? It is impacting folks' ability to get their primary health care, those cancer screenings, that preventative care that they need. But I want to be really clear that this is a targeted attack on Planned Parenthood, specifically because we provide abortion care. And it is specifically targeting Planned Parenthoods in states where abortion is legal. Outside of this targeted attack on Planned Parenthood, this bill has just disastrous impact on Medicaid as a whole. It makes sweeping changes to how our Medicaid program is administered. And here in Vermont, about 168,000 Vermonters are on our Medicaid program. That's about 24% of our population. And when we think about Medicaid changes, this is not just going to impact those who are directly on Medicaid, but this has really devastating effects across our healthcare system. Medicaid is kind of the bedrock of a lot of our healthcare system, which you might have seen in the news was already struggling. And our rural hospitals, our local FQHCs, our Planned Parenthoods are already in really tenuous financial situations. And so these changes to Medicaid are really going to compound that for a lot of our providers. So there's the patient impact as well as the provider and system impact. But I want to dig in just a little bit more to the specific Medicaid impacts. So as many as 45,000 Vermonters are going to lose their health care coverage. But most of that is not going to go into effect until 2027, which is a really specifically intentional thing in this bill because it is after our midterm elections. So these delayed impacts include work requirements, increased eligibility determination, which right now is annually, is going to move to every 6 months, making it more cumbersome for patients to stay on Medicaid, as well as increasing the administrative burden on our Medicaid offices. Retroactive coverage limits are shortened, like the list just keeps going on. And then, there is eligibility limited to citizens. And while these don't a lot of the citizenship impacts don't go into effect right away, we're already seeing the impacts of this play out in our system. Folks are not coming to get care if they don't have citizenship documentation, really out of fear, right? And so they're delaying preventative care, they're delaying prenatal care, they're delaying care that they need out of fear of the ramifications. There's so much more I could say about Medicaid, but I think I will send it back to you, Dan.
All right.
Thank you.
Thank you, Jessica. I made an error earlier. I introduced all of the electeds that were in the room and missed South Burlington's representative, Emily Krasnow, who's way back in the back of the room. And while we were doing the first round of answers, Senator VPIRG from Madison County and Representative Carol Odie from Burlington both joined us as well. Thank you so much for being here. Is there
Daisy.
someone? Oh, and Representative Daisy Rebecca from Winsky is also here. So great crowd. Our next set of questions, Ivy, I'm going to have you go first.
Sure.
It's a two-parter. What state resources do you think should be used to reduce harm to Vermonters, and where do you think those state resources can be directed to prevent the worst impacts?
Thank you, Dan. Vermont has a long legacy of being a leader in bold, innovative policies that move us towards food security for all in our state. And now is the moment to lead again. The only reason this mega bill enacts cuts to SNAP and other basic needs programs like Medicaid that Vermonters depend on is to give massive tax breaks to our nation's most wealthy, including the wealthiest Vermonters. So what this means in Vermont is that the top 1% of our state's tax filers will get an average federal tax break of nearly $60,000 per year. We're talking about the most resourced, most wealthy people in our state getting a tax break that is more than the median annual income for a Vermonter, which is absolutely unacceptable. So how we're collectively paying for the top % of Vermonters to get annual tax breaks of $60,000 is on the backs of lower and middle income Vermonters who need support to buy groceries and get medical care. Hunger Free Vermont is a really proud partner of the Fair Share for Vermont campaign, which is asking the legislature and the Scott administration to claw back the federal tax breaks, which are in the hundreds of millions, to ensure that the wealthiest in Vermont pay their fair share of our taxes. And I say all of that because that is a state resource that is underutilized, that should be used to reduce harm in Vermont. In terms of where those state resources should be directed to prevent the worst impacts, it's a complicated question. I'll start by saying we know that the first group of folks to be immediately impacted by, I'm calling it the eligibility cliff, because it's not just SNAP, it's not just Medicaid, there are other programs that folks tap into. It will be a cascading crisis. The first group of folks to be impacted are our immigrant community members. So one of the cuts to SNAP in the federal bill is a complete bar on access to the SNAP program for refugees and asylees and other humanitarian entrants. And that means about 1,600 people in Vermont who are currently in our state under that immigration status will lose their benefits October 1st. So Vermont really needs to contend with the basic needs supports of our immigrant community members now. And I think we also, our state leaders really need to pay close attention to ensuring our state agencies who administer programs like SNAP are resourced so they can operate programs like SNAP in a way that is efficient, dignified, and meets the needs of Vermonters. Hunger exists when people aren't able to get to meet all of their basic needs at once. And there is a short list of basic needs that we all need, right? Food, shelter, healthcare are chief among them. And for us, it's food security all the way down. And I implore our state leaders to not take a scarcity mindset and think about this or that. Our community members are tapping into federal nutrition assistance programs and healthcare programs and heating programs. And we really need folks to take a holistic approach to addressing basic needs security, because everyone in Vermont deserves to be fed, housed, and cared for. And that's really not just a hope. It's something that we can commit to as a state with the right policy choices. And I do think now is a really important time to ask ourselves, what is the role of state government? And Vermont has the resources to ensure the best outcome for Vermonters in this moment. And we really must push our state leaders and policymakers to think creatively and innovatively. And I deeply appreciate that so many are in the room right now listening to us. Design policy choices that really center the most impacted by these federal cuts, because meeting the needs of folks most impacted will in turn meet the needs of all of us. Thank you very much. Which way am I going with the mic? Okay.
Thank you, Ivy. Jessica, same two questions.
Thank you. Well, I couldn't agree with what Ivy just said anymore. The folks that we serve at Planned Parenthood are also the folks that are accessing SNAP benefits, are the folks that are maybe housing insecure, right? And so when we think about these issues, we have to think about them as a holistic system. And you know, as advocates, I think about this question a lot. We often get asked this question by state legislators, like, how do you want us to fund this, right? And I think as advocates, it is our job to elevate what is so important and what those basic needs are and where those gaps are. And then we need to come together as a whole to figure out how we can fund those. And, you know, like, our budget speaks to our priorities. And so we can find the money when we need to. And this is one of those moments where we need to. And I think the Fund the Vermont's Future campaign is a really great example of finding external solutions for these problems. And you know, that said, we know that healthcare is just a foundational bedrock of our healthy communities. And we're coming to this defund and these Medicaid cuts in a time where we have had historically low Medicaid rates for many, many years, and a system that is built on unfunded care. And so our healthcare system is already out of balance, right? And we are seeing that in extremely high private insurance rates. Our rural hospitals are struggling and are closing, and a really high utilization of emergency care across the state. And you know, these are places where these cuts are gonna be impacted first and hardest. And so thinking about not just Medicaid and how do we backfill Medicaid funding, but really looking at our healthcare system in a really holistic way and broadly, and making sure that our foundational community players, like our FQHCs, our federally qualified health centers, our rural hospitals, our Planned Parenthoods, are funded and funded at rates that are actually sustainable so that they can continue to provide that really needed critical and primary care in our communities. There was an analysis done that if Planned Parenthood were to close in Vermont, our FQHCs would have to increase their patient loads by 100% to navigate those closures, which is just an unsustainable solution. And so we really have to look at all of the pieces, because it's that domino effect for sure. And then, you know, I say that, and also finding that funding to make sure that those Medicaid rates are still getting reimbursed is a really critical piece of that as we're looking at the whole healthcare system, making sure that those gaps are removed. And then keeping people insured is really critical, right? Maintaining or increasing our Medicaid rates to adequately cover the cost of care, but making sure that those folks who are losing Medicaid, who those high deductible, high cost insurance plans are not working anymore for their families, that there is a way for them to get insurance, because we know that people who have healthcare insurance are more likely to go to the doctor early. They're more likely to get preventative care. They're more likely to get problems checked out early before it becomes an emergency, before it becomes complex and expensive for our systems. And so making sure that we have that long arc of getting people that preventative care that they need is just so incredibly important. So I don't know that I have a lot of answers of how we fund it, but I will continue to shout from the rooftops just how important healthcare is across all of our systems.
Before you clap, can you just define FQHC and maybe give some examples?
Yeah, federally qualified health center. So here in Chittenden County, we have the community health centers of Burlington. It is a specific group of primary care that have a federal mandate to provide free and low cost care in a similar way to Planned Parenthood. So it operates on a different funding mechanism, but they have that same mandate to provide care to anyone who walks through their doors, much like our emergency rooms as well. Yeah.
Thank you. Ben, same two questions, please.
So I think we've already covered a lot of ground. I want to second a lot of what Ivy and Jessica just said. I want to take the second question first, be very brief, and then talk a little bit more about sort of how to think about funding and resources more generally. So in terms of how, which things are the most important things to protect right now, I'm paraphrasing the question a little bit, but one, I couldn't agree more that we need to be looking at the whole, really the whole economy of Vermont, every part of Vermont's government that Vermonters interact with, that, when somebody's putting together a household budget, they don't get the luxury of sort of pretending like these are separate things, right? Like they all interact with each other. And that's obviously also a really important part of legislating, in particular, when you're looking at the budget committees, they have to balance hundreds and hundreds of different things that the state of Vermont's spending money on. And really looking at the picture holistically is very important. As an advocacy organization, we're often in the situation of going into the appropriations committees that are making these decisions and saying, we really think that this much money for this particular thing is very important. And we recognize at some level, there's a limited pot of dollars, especially if the legislature is not looking at new revenue. And if we're asking for something, somebody else isn't going to get that. And we're all very careful never to say, and don't fund their thing, because our thing's better, right? But but at some level, there is that balancing act. And it's just a very hard job that legislators have to do. So I just want to recognize that up front. I did want to name one program that hasn't come up yet. I do think, as I said, even as we are triaging these incredibly pressing, very immediate needs that Vermonters have, we cannot afford to forget about the future and the investments we could be making today that will make things better over the long term. There are a lot of those in the energy and climate space. There are a whole host of them, those when you're talking about hunger, when you're talking about healthcare, when you're talking about any number of other systems. And so we can't be so focused on the short term that we forget to set the long term up for success. And that's part of that balancing act. The particular program I wanted to mention that is a very acute short-term need potentially, depending on how things play out in DC over the next few months, is the LIHEAP program, the Low-Income Home Energy Assistance Program. In Vermont, we think about it as a program for heating assistance. The H is not actually heating. In many states, that is primarily a system to pay for air conditioning, so you don't die of heat exposure in the summer. In Vermont, it's, over time, we'll be trending towards being both things. RFK fired everyone who runs that program earlier this year, and Trump is proposing to zero out the funding for it. That's a program that brings in, I don't know the exact figure from the last fiscal year, but around about $20 million a year to help Vermonters stay warm in the winter. It directly pays for their fuel assistance. And that, if that does go away, Vermont absolutely needs to be looking at what can we do to backfill that, even as we're looking at these other gaps that we're going to need to fill. The other thing that I wanted to say, zooming out from any one program, I could not agree more with a couple of things that Ivy said. There are wealthy Vermonters who could be paying more, especially right now when they're getting a giant tax break. You mentioned a lot of the specifics of how that can happen. There's one other example is right now, if you're a second homeowner, we're subsidizing your fossil fuel use. You don't pay any sales tax to heat your home. That doesn't make any sense. There's no sales tax on heating fuel in Vermont because that is an essential good that Vermonters need to buy, and there are a handful of those that the state has chosen not to tax. But why on earth, for the 20% of homes that are not actually occupied by Vermonters on a year-round basis, would we be subsidizing the heating fuels for those buildings? That's just silly, especially in this moment when something like LIHEAP, where the Vermonters actually living in their home may not be able to fill up their oil tank, have this funding need. Why would we be doing that? So that's just another example of potentially creative thinking in that space. I do think there are some things that we could be doing to use resources more efficiently in the energy space. Look at Efficiency Vermont, and to some degree, because of decades-old statute, they're trying to fight the climate crisis with one hand tied behind their back. You could provide them more flexibility to do more on climate pollution, to do more for low and moderate income Vermonters. But let me say one more thing on things that are a little bit outside of what we typically consider quote unquote resources, dollars and cents. And there are places where we as a state could be cutting red tape, could be reducing costs. There are a couple of those in the solar space that, especially as we're looking at elimination of decades old tax credits for solar, that we could be doing more to reduce the price of building solar, large and small, in Vermont. There's something called portable solar, where you're just buying a couple of solar panels and plugging them into your home. It's not even going up on your roof. That's something that there's some bureaucratic barriers to in Vermont right now. Other states are starting to look at that. Utah just moved. It's very common in Europe. We could do more of that sort of thing here, reduce the cost of solar, make it available to renters. And on the other end, and I'm not going to get into the the wonky details here, but there are bureaucratic barriers that are driving up the cost of building large solar farms in Vermont that are just stupid. They're 15 years old, and we could be cutting those. And it's not going to totally make up for the fact that the tax credits are disappearing overnight, but it's going to help. One last thing that I wanted to say here, we need to be looking at new resources. That's implied in all of our answers, but I think it needs to be said very explicitly. If we are thinking we're going to just move some money around, and this is the way the Scott administration approaches these problems, we're just going to rob Peter to pay Paul and everything's going to be fine, that we're just absolutely fooling ourselves. That is not how we are going to solve this problem. And that leads me to my last point, and I'll turn it over back to Dan. Our legislature needs to stop being afraid of vetoes. It is a little silly on some level to pass a bill that is never going to become law because the governor will veto it. But at the same time, if the right answer for Vermonters is we need more resources and they should come from the wealthy because they can afford it, and low and moderate income Vermonters can't afford these horrible actions that we're seeing from the Trump administration, then put that bill on Governor Scott's desk and let him be the one to say to Vermonters, no, we're not going to backfill the SNAP cuts, we're not going to backfill Medicaid.
That's just genuine applause. Do you have more to say? 'Cause
No, that actually was the end.
all right. Last of the overview questions. Jessica's going to start with you. What actions can concerned Vermonters take to fight back against these cuts?
Yeah, thanks, Dan. So I think that Vermont works best when we're in relationship with one another. And so my answer to this question is really talk to your people, find your community, right? Like, develop a relationship with your state legislators. Let them know what's really important to you. And so you have that back and forth so that you can communicate with them and they can communicate back to you, right? Right now, our Attorney General, Charity Clark, just filed a lawsuit with a few other states to protect Planned Parenthood. Send her an email. Let her know that that's really important to you, because the more that we lift up our folks who are doing the good work in this state, the more they're going to be able to do that work. And then the same thing with your other relationships, right? Tell your family, tell your neighbor, talk across the fence, tell them that Planned Parenthood is important in this state and that it is more than just abortion, but abortion is important too, right? Talk to folks, get involved, become a volunteer. One of the best ways you can volunteer is just to keep spread the word about us. And one of the things that I've been talking about more and more is that one of the best ways you can help us beyond donating, beyond being a volunteer, is to become a patient, right? Especially if you have insurance, because that's where we're getting paid right now. And Planned Parenthood of Northern New England, our health centers offer amazing, incredible lifelong care. Out of the nation, we're in the 95th percentile on the Press Ganey patient satisfaction surveys. So it is really incredible care. They just started menopause care, and we're hearing just such phenomenal things from patients who, like, it's the first time they've ever truly been listened to. So there are lots of ways that you can keep talking about this, but the more that we talk about it, the more that we talk about its importance with the people in our lives, the more that that this is going to be elevated as an issue, and the more people who are going to be paying attention, right? We need folks to know that these cuts are coming, and we need folks to really know that a lot of this hurt from Medicaid is not going to be felt until after those midterm elections. And so we need people to be aware of what's happening now so that we can get that advocacy before it's too late.
Thank you, Jessica. Ben?
So talk to your legislators. A lot of them are here tonight. You can be easy access to them. I mean, genuinely in Vermont, it is fairly amazing how easy it is to have a conversation with your legislators. I know it often happens, at the grocery store, or impromptu at the farmer's market. So that's always number one for us, as an organization that works so much on state policy. If you think you've heard good ideas tonight, if you have other good ideas, talk to your legislators. But I actually want to also bring up Charity Clark, our Attorney General. One other thing that would be very, very helpful right now is if you could give the governor's office a call and tell him to get her back. Because right now he is not doing that. I mentioned earlier the lawsuit that she brought along with about 15 other state attorneys general on electric vehicle charging. The Agency of Transportation did not support that lawsuit, would not give her basic information that she and her team needed, and as a result, Vermont was one of 3 jurisdictions that did not get an injunction from the Trump clawbacks in that area. Again, on Solar for All, I'm concerned that that sort of thing could happen again. We don't know exactly what's happening with this. It came out in the New York Times literally yesterday. Again, this is the $60 million for low and moderate income solar I mentioned. And the White House and the EPA has not officially announced that they are making these cuts or attempting to illegally make these cuts, these clawbacks. But it sounds like that could happen as soon as Friday. I would assume, I have not been in touch with the Attorney General's office, they probably wouldn't tell me if I had, but I assume that she will be one of the Attorneys General saying that is illegal, this is funding that we have rightfully been delivered under federal law. It was not repealed under the Inflation Reduction Act, the bill that just passed that we were talking about. So it's still, lawfully Vermont's money. And so you can't do this, Trump. And if the recent pattern persists, there's a real chance that the Scott administration will not support that lawsuit. I don't know what the effects of that could be here, but it certainly wouldn't be positive. So his number is, and I'm serious, you get out your pens, you have if you pick these up at the beginning of the day, you can keep one of them, 802-828-3333. You can also go to governor.vermont.gov and scroll down to the bottom of the page, and there's a form to email him that you can link to there. He really needs to get her back. She's doing a lot of really incredible work, and the Scott administration has been in duck and cover mode with Trump far too often. I think we're going to leave it there. I know we have a lot of questions from the audience, so I will hold off on any other thoughts.
Thanks, Ben.
I really agree with everything that Jessica and Ben have already said. Call your legislators, email the governor, call the governor. It might feel like it's just an email or it's just a phone call, but it really, really matters. These offices are tracking what people are calling in or emailing in about, and that becomes the topic of conversation, right? So that action seriously matters. I also will +1 to everything Ben just said about getting the Attorney General back. We need a strong working relationship between the Scott administration and the Attorney General. Folks may have been following the media in the last day about the Scott administration's decision to submit private sensitive information about SNAP participants from 2020 to now to the Trump administration, while USDA is in two lawsuits. One is a multi-state lawsuit with 21 other states. Vermont is one of 2 New England states not part of that lawsuit. That is unacceptable, and the Attorney General was not able to take action because of the Scott administration's decision. So if that is upsetting to you, I implore you to call or email the governor's office, and also call or email the Attorney General's office. I think another really important thing that Jessica said was both saying what matters to you and also thanking our state leaders when they take action that you believe in is so important. The other thing I'll say is, just underscoring what Jessica said about having conversations with your neighbors, with your friends, with your colleagues. A core part of our work is shifting the public narrative about hunger, the root causes of hunger. Hunger is a policy choice. Food security is also a policy choice. And what you can all do, what we can all do, is really internalize that, right? Food security is a policy choice. We can make that decision to ensure the best outcomes for people in Vermont. And talking about the root causes of hunger, which are systemic policy choices, systemic injustice and policy choices, will help to dismantle a lot of the myths and misconceptions and stigma associated with that experience. That will go a really long way. And the last thing I'll just say is please do not give up on hope and do not give up on joy. Those are fierce tools that we all have in our toolbox that we need to keep sharp, and we need to share with our neighbors when they need those things. So I just implore all of us to keep those two spades in our back pockets. Thank you.
I actually want to piggyback on that, and then we'll get to questions, I swear. I wanted to just share one story of hope, and it is not the, oh my God, we want everything hope that we all wish that we could really tap into in this moment. But I just want to be very clear, when we're talking about you need to call this person, talk to that person, organizing works, making your voice heard works. It doesn't work 100% of the time. It doesn't work as well as we wish it would, especially when the power dynamics in a place like DC are what they are right now. But I just wanted to share one story about how that horrible bill that we were talking about could have been so much worse if people were not organizing their asses off all around the country. And that is true in a bunch of areas, and I'm sure there's a million stories like this that I don't know about, but there's one that I do know about that I wanted to share. We, VPIRG, VCV, VNRC, a number of other organizations, worked with Maine Conservation Voters, Dan's counterparts over in Maine, to turn out Vermonters to virtual phone banks to call Maine Conservation Voters members and urge them to call Senator Collins, who was one of the swing votes on a number of these issues. Now, she ultimately ended up being very disappointing in a number of ways. She usually is. But there are pieces of that bill, the